It's Heart Health Month, a time to prioritize your heart and talk about the leading cause of death in the U.S., cardiovascular disease. It's an emergency no one wants to find themselves in. But when a heart attack patient comes into DRH Health, Dr. Kris Mullins and her team are ready.
It is when they hit the door, the clock starts. You have an hour to get that artery open. It is called door to balloon time. They will bring them into the Cath Lab. My team looks like little ants getting them ready. And then I'm gonna cry because I'm just so proud of my team. I have a really, really good team here.
As you can hear, it's a job she takes seriously and appreciates because it can mean the difference between life and death.
As you can see on this one, this patient came in and had a totally occluded right coronary artery. This is right after we ballooned the vessel, and you can see this area right here is the culprit, and all that heart muscle is dying and waiting for us. It's just like you've got, a string tied around somebody's neck.
And it's those life-threatening moments that really make Heart Month so important, and why the American Heart Association spends so much time educating us about the #1 killer. And it starts with prevention.
Keeping your weight in a normal range, stopping smoking, or at least cutting back, keeping, know your numbers, so keeping your blood pressure well controlled, your cholesterol, if you're a diabetic, keeping your A1C well controlled, and then 150 minutes of physical activity per week.
And you don't need an expensive gym membership to do that. She says just try to increase your physical activity. Another important tool is an annual screening.
So the American College of Cardiology does recommend for men after the age of 45 to get their annual screenings. So that would involve looking at your cholesterol numbers, your blood pressure, your glucose readings, just to see if you are at a higher risk for heart disease.
It's also important to pay attention to any symptoms.
Chest pain, chest tightness or pressure, fatigue, especially new fatigue that wasn't there, shortness of breath with minimal exertion. Those are all red flags for us.
And the good news is that there are lots of treatment options if you are having symptoms. Everything from lifestyle changes to medication, even a number of procedures. And not all of those require surgery. But at DRH Health, Dr. Mullins shared how even if surgery is needed, technology is improving to make life easier for patients. And that includes the leadless pacemaker.
There's no battery pack, and there's no leads that you have to worry that might get pulled out of place. So patients that use a walker or have to push off to get up from a chair, a lot of times, not a lot, but there were some risks that they would pull the pacemaker out of its positioning, and they would have to come back in, and we would have to redo the pacemaker. Or they would have to go to a nursing home during those 4 weeks because they didn't have anyone to care for them. They don't have the battery pack. They don't have to worry about keeping their arms still. They spend the night, go home the next day.
And those leadless pacemakers, they can last anywhere from 10 to 15 years. If you're interested in contacting Dr. Mullins or learning more about the cardiovascular services the team offers, we have a link to their website and even contact information for you. It's all at newschannel6now.com.